Siamo a Milano dove è in corso un convegno dedicato alle cellule CAR-T, una terapia che ha rivoluzionato il trattamento di alcuni tipi di linfomi e leucemie. L'evento è organizzato da Kite Gilead, produttore di 2 delle CAR-T attualmente disponibili in Italia. Noi parliamo proprio degli aspetti produttivi di questa terapia con Crowell, che è Vice President del Manufacturing di Kite Gilead, azienda che attualmente ha 3 impianti produttivi di cellule CAR-T, di cui uno in Europa ad Amsterdam. So, Dr. Crowell, how many treatments can you produce at your facility? How many patients are you allowed to treat? And for which countries in Europe?
Sure. So in Amsterdam, where our facility is located, we primarily supply European patients, including Middle East as well as Brazil. Currently, we're capacity-wise able to produce around 4,000 therapies per year. So quite a significant amount of therapies. And the markets were approved around 25 countries and is continuing to grow each year, but 25 countries throughout Europe.
How is your facility structured?
Sure. So we have around 900 employees that work there full-time. It's a variety of applications that we do at the site. So we have folks primarily in manufacturing. Our quality organization is a large organization as well. We also have a supply chain and logistics organization, and we have a facilities engineering organization as well.
Which strategies are in place to increase volumes at your facilities, if any?
Yeah, great question. So what we're doing at Kite, and we've been doing for several years now, is looking at ways to improve the efficiency of the current process that's been approved by EMA. And one example is automation. So we're looking at including automation as part of the manufacturing process. So soon we will be able to produce therapies using a semi-automated process. With that simplification and automation, we can increase the capacity of the site as well. So really around how do we automate and close the process so that we can actually deliver more therapies to patients using that technology platform in the future.
What is being done to shorten the vein-to-vein time, that is the time between leukapheresis and the reinfusion of the modified cells to the patient?
Sure. So several things. One is just recently we announced in the US, we've shortened the manufacturing process by 2 days. That process is now approved in the US and is supplying patients there. We have plans this year to engage regulators in Europe around our plans to bring that shortened process to patients here. So we're able to improve the turnaround time from 19 days currently down to 17 days. And also with the shortened manufacturing time, we're also looking at ways of reducing the testing that's required prior to release, and that has additional benefits of shortening the overall cycle time as well. So ideally, we'll be at 17 days this year, and then we'll be moving towards closer to 15 days turnaround time in the future. And it's worth mentioning that comes up with a success rate of 96%. I think it's quite impressive being the world leaders in cell therapy that we're able to produce reliably the therapies for patients that need them.
Why is it so important to reduce the vein-to-vein time?
Sure. So, I mean, every day matters for patients, right? So if you think about the amount of patients who actually get prescribed and then apheresed for this therapy, a fair number of them actually never receive the therapy because their disease progresses. So every day does count. So even a shortening of 2 days is super important to return that therapy to the patients as soon as possible to give them the best chance of a positive outcome.
At your facility in Amsterdam, do you also produce CAR-T cell for Italian centers?
We do. So we produce for all of Europe, including Italy. In Italy currently there's 35 authorized treatment centers that are qualified to provide the therapy, and that continues to grow within this market here. But yes, we provide product to Italian patients through our facility in Amsterdam.